Welcome to week one. We just want to give you a few tips to get started. Now the most important thing is the placement of the device. So we want to go over the target treatment area. So as you can see, Tim has this sleeve on just for demonstration purposes. But when we're working on golfer's elbow, which is on the inside of the elbow, as you can see, you can feel that bone on the inside of the elbow, which is demonstrated here. And these forearm muscles come in and turn into a tendon that attach to that bone. So the target treatment area is on that tendon just below the bone. Now when we're treating tennis elbow, it is the same thing but on the outside of the elbow. So again, find that bone on the outside of the elbow. You can see where the muscles come up, transition into a tendon and attach to that bone. So the target treatment area for tennis elbow is just below that bone on the outside of the elbow, running down towards the wrist.
There are more videos online that go into detail on exactly how you use the robot for tennis and golfer's elbow, but I'll give you a couple tips. First of all, it starts out with the device. The best way to do it for a lot of people is to support it with a pillow, but everybody's different, and it'll take 3 or 4 times in order to get comfortable with the device.
Now as you start treatment, don't forget to use the emollient. That's just lubrication on the skin that will help the scraping blade slide down the tendon without friction. Couple things to note is as you start, you might get a little bit of increased pain because remember, we're breaking up scar tissue, we're bringing blood flow to that area that might cause a little bit of increased pain. You also might get a little bit of bruising because again, as we break up that tissue, you might get some bruising. Again, nothing to be concerned about and is very common. So a common question we have is, what if I just got a cortisone injection? Now the purpose of a cortisone injection is to reduce pain and reduce inflammation, which isn't necessarily healthy for the tendon. So if you've had one recently, try to wait 2 or 3 weeks before you start the program so we can actually cause some of that inflammation to start the healing process. Now if you are still being very active and doing a strenuous activity later in the day, it's okay to use ice after that to control swelling, but after our treatment, make sure you avoid ice for at least 2 hours.
As always, feel free to reach out to the team if you have any questions.